And good evening, everyone, and welcome to tonight's webinar. And it's also part 3 of our MS Path to Care Wellness webinar series. Tonight, we're going to talk about homework and relationships. We're proud to partner with Santa Fe Genzyme on this exciting new series. And MS Path to Care is a series of resources and programs to empower people affected by MS to be active partners in their healthcare experience, and as well as their overall wellness and quality of life. So we try to create a roadmap through different resources and programs that are available on mspath2care.com. So we encourage you to continue your path through that website. As I mentioned, this is part 3 of our series, and we welcome back those of you that have joined us for either one or both of the previous webinars. We've talked about emotional, cognitive, and spiritual well-being on the first webinar. And then last week, we talked about diet, exercise, and healthy behaviors. And it's fun to close things out tonight talking about work, home, and relationships. And if you missed any of our webinars in this series, they're all archived on the CanDo MS website, which again is cando-ms.org. Speaking of which, our 2 great speakers, hopefully familiar faces to those that have joined us for the first 2 parts of our series, as well as many other CanDo MS programs. We have Ross Kalb, who's a psychologist, and Mandy Roehrig, who's a physical therapist. And now it's my pleasure to turn things over one last time in this series to Roz and Mandy.
So for those of you who've been with us on the other 2 webinars, this little graphic will look very familiar, but this is the way we describe the various areas of wellness that we consider in all of our programming. And tonight, as Brian mentioned, we're going to be focusing on work and home and relationships. And if you missed the others, go back and listen to them in the archived format. So this is one of our favorite graphics, and you've seen it in the previous sessions that we did on wellness. It's very important to recognize that you're not managing your MS alone, and you're not managing your wellness alone. Although you and your support team, friends, family members, healthcare providers, anybody who supports you in your efforts to be well, are at the center of this team. You are the core, you're the leaders of this team. And you have a core healthcare team around you, which is your neurologist, your primary care physician, maybe a nurse practitioner or a physician assistant, or an MS nurse. They're the ones who are right with you every step of the way. And then you have an extended healthcare team who may help you with various aspects of your wellness or work on your symptom management, or you call on them as you and your core team recognize that you may need their professional expertise. So again, you are not alone, but you are the leader of this very, very important team.
So this evening, our learning objectives for all of you are as follows. We want you to recognize common challenges at work and home related to MS symptoms and disease progression. We also want you to be familiar with the healthcare providers who can assist with managing work and home challenges. We want you to learn specific strategies to manage daily activities. Learn how to communicate about the impact of these challenges on relationships and identify shared solutions that may be mutually beneficial for you and your support partner. Be aware of potential barriers and strategies that may potentially help you address them. And lastly, understand the relationship between work, home, and relationships, as well as the other dimensions of wellness that can impact them. So we have a lot to cover this evening. But to do this, we're going to start with a vignette, and we want to introduce you to this lovely couple by the name of Jayme and Ted. Jayme is a 37-year-old loan officer diagnosed 10 years ago with relapsing remitting MS. She has been married to Ted for 13 years, and they have 2 children, ages 9 and 11. Ted works for a tech company. As far as their daily activities go, both are employed full-time, and together they juggle the care of the house, shuttling their children around and hopefully finding time for some shared activities together. Ted is negotiating with his work to try to work more from home. The physical challenges that face both of them, specifically Jayme, include fatigue, foot drop, bladder urgency, occasional falls, wall walking in order to avoid using a mobility aid. Her cognitive challenges include slowed information processing, problems with memory, planning, prioritizing, and organizing tasks. So they have a lot to handle, a lot to manage. We do think they also have some concerns that they've articulated that they both share. They're wondering if they need to take a fresh look at their juggling act. Are they managing their situation as optimally as it could be done? Are they maintaining a balanced partnership in the face of MS? Are they feeling like their roles are being divided, shared? Are they working together, or do they feel like they're adequately supporting one another? Does it actually feel like a partnership, perhaps? Are they planning for the unpredictable financial future? It sounds like so far what we've heard, they're just mainly planning day to day and just trying to get through the challenges of a day with the family. Are they addressing Jayme's physical and cognitive challenges sufficiently? And lastly, are they communicating about the impact of Jayme's MS on the family life? Are they really talking with one another and with their children about Jayme's MS and how that's changing roles and impacting one another? So Ross, tell us a little bit about, we've talked about the concerns, tell us a little bit about some of the challenges and priorities that need to be kind of pulled out of their situation.
So from our perspective, we would really like to see Jayme and Ted look at whatever cognitive changes Jayme is experiencing for a couple reasons. We want them to think about how those changes may be impacting her ability to do her job effectively and stay employed over the long term, how those cognitive changes might impact their ability to communicate effectively with one another, with their kids, with the people around them who provide support, because as we know, cognitive changes can affect communication. And we also want to make sure that they're looking at the ways that they are coping and how they are adapting to the changes that MS brings to their lives. And we know that people, even loving people in a very close couple, may have very different types of coping strategies. So it's important for them to talk to one another about how they cope and adapt to make sure that those strategies that they're using are complementary, even if not identical, and that they can be effective as they try to manage the challenges that come up in daily life. But equally important, they have to manage all the symptoms that Jayme is having. So Mandy, what do those look like?
So I would say the key priorities for this couple with respect to their physical symptoms include managing her fatigue optimally. That can clearly have an impact on her work, home relationships, and her community activities. Her more physical problems related to walking, her drop foot, balance, and falls, that all impacts, again, not only her work responsibilities, but home and relationship as well. And certainly bladder urgency and bladder challenges can complicate anyone's life. As far as environmental adaptations, they need to maybe consider some other options and for her home setup and maybe for her work setup that could be more optimal and allow her to manage these things differently. Additionally, considering maybe some mobility aids. I don't think for Jayme it has to be an all or none type of a thing. I think maybe mobility aids that she can use when she needs them might be a good option for her. We can talk about that. And certainly some exercises that are going to allow her to manage all of these symptoms more optimally. The last thing we want them to consider are the shared activities. The shared activities that they have as a couple that maybe they used to do that they don't do anymore, but also the activities that they do with the children as a family. So lots of important priorities we're going to talk through.
So now I get to talk about cognitive challenges, which for those of you who know me, I spend a lot of time talking about these, but I think it's so important because way more than half of people with MS are going to experience some degree of cognitive change over the course of the disease, maybe as a first symptom, maybe later. But this is a very, very common symptom. And the most commonly affected functions are the speed with which a person can process incoming stimuli or incoming information. And we are processing information all the time through all of our senses. And for a person with MS, that can be really slowed. And that slowing in turn affects people's ability to remember what they see or hear or read. It also affects attention. So we also see people having significant problems with memory for recent events or paying attention or multitasking. People have trouble planning, prioritizing, and decision-making, which if you think about Jayme and Ted's busy life where they're juggling jobs and childcare and family activities, it's all about planning and prioritizing and decision-making. And sometimes that can be very, very challenged for a person with MS. And then visual spatial skills, the kinds of things that help you know when to turn right or left at a four-way stop, or just how to navigate in space. Now, the good news is that there are cognitive functions that are not affected by MS. General intelligence remains the same, maybe slower, but one does not suddenly become less smart than before. People do continue to retain their long-term memories of their first date or a science teacher they hated in 7th grade or special events that happened to them growing up. Those are locked in memories. And people don't lose the ability to comprehend what they're reading or what they're hearing. They may not remember it as well, and it may be slower, but the comprehension is the same. The important thing to remember about cognitive changes is that they can occur at any point in the disease, even very, very early in the MS disease process. Again, it can be a first symptom of MS, and it's generally unrelated to a level of physical disability. So one can have a lot of physical impairments, but no problems with cognition. And conversely, one can have very, very significant cognitive changes, but have no visible physical disability whatsoever. So we can't tell by looking at someone how much cognitive impairment they may be experiencing. The reason that we focus on this so much is that cognitive changes have a significant impact on daily life. They are, along with fatigue, the most common reason that people leave the workforce prematurely. It is not problems with walking or vision that tends to drive people out of the workforce. It really is cognition and fatigue. So we want to recognize it very early so that we can help people stay employed as long as they want to and are able. Cognition also impacts relationships and communication, because when your information processing is slowed and you have difficulty remembering, it means that your communication with others can be significantly changed or impacted, and people need to understand how the cognitive changes may be influencing the ways that you interact and talk. So it's very, very important that people have early and ongoing screening of cognitive deficits. And the National MS Society has recently published a paper in which it is recommended that everyone is screened for cognitive changes at the time of diagnosis, and then at least yearly thereafter, by knowing when somebody is having difficulty. It makes it possible to then intervene and provide them with tools and strategies to help them compensate for whatever cognitive changes that they have, so that they can continue to function comfortably and confidently in the workplace and at home. More complete assessment, a more comprehensive neuropsychological test, as we talk about it, is very important if somebody has been identified as having difficulties, because then you want to do more complex evaluation to identify what their cognitive strengths are, as well as areas where they're having challenges, because those cognitive strengths are what they're going to rely on to help them compensate for problems that they're having. And certainly if one is applying for Social Security disability on the basis of cognitive symptoms, it's essential to have the full neuropsychological test battery to back up that application. So fortunately, there are several healthcare team members who can help. And if you remember that first diagram, these are the folks in the outer but no less important circle of people who can help. So neuropsychologists are psychologists with particular training in the evaluation and the treatment of cognitive dysfunction, and they can provide the most comprehensive neuropsychological exams. Speech-language pathologists, not all of them, but many speech-language pathologists also have a special interest in cognition, and they will do screening and assessment, as well as working with people on some remedial strategies or compensatory strategies to help them manage their cognitive changes. And some occupational therapists, not all, but some occupational therapists also have a particular interest in cognition and communication, and they provide screening and assessment as well. All of these disciplines use somewhat different evaluation techniques and intervention strategies, but they share the goal of wanting to help people identify what's going on and be as functional and confident and capable in everyday life as they possibly can be.
Roz, can I ask a quick question? Can you
Sure.
offer a little bit more detail as to what a screen might look like and what someone can expect in a screen versus, say, the full neuropsych exam like you commented on?
It's a great question, and there are quite a few screening tools out there. In this recently published paper advocating for early and ongoing screening, the particular test that they used as an example was the symbol digit modalities test, which takes approximately 5 minutes. So I think the goal is to have healthcare providers offer this kind of very, very brief screening, which basically just offers a signal of the fact that there might be a problem. And it looks specifically at information processing speed, because that's considered kind of the cardinal problem in MS. The longer batteries range from 45 minutes of testing to 90 minutes, all the way up to 6 or 7 hours, depending on how many different tests are used in the battery. Thanks for asking.
Yeah, thank you.
So as we talk about the challenges that Jayme's having, I think it's very helpful to think about if these are issues that you might be experiencing yourself, and what you might do or what Jayme might do to solve this. So Jayme is unable to process information as quickly as she used to. She experiences it as having like molasses in her brain. She can still think and do things, but she feels very, very slowed down. So Jayme herself, as well as the others around her, need to allow more time for Jayme to think and respond, because it may be delayed. Her ability to respond to a question or process information that somebody is giving to Jayme may be significantly slowed, and they need to pause and wait for that. If somebody has reduced attention, or they're very, very easily distractible, which makes multitasking very difficult because one task interferes with thinking about the other task, right, is to reduce distractions. So if Jayme and Ted are having a conversation, for example, and Jayme can't follow what Ted is saying or can't remember it, it'll be very important for them to reduce distractions during the conversation. They shouldn't have that conversation in the kitchen with the TV going and the kids arguing and everybody trying to get ready to go to school, which is a very common scenario in daily life. They may need to step into another quiet space to have that. Ted may need to make sure that Jayme is focused and hearing what he's saying and then confirming what she has heard. For memory problems, we recommend repetition, but also the use of ticklers, reminders, a family calendar, keeping things in the same place so that you don't spend all your time searching for your keys or your glasses or the TV remote. So organization, as much as possible, is used to replace memory, right? You shouldn't have to think about where everything is or when it's happening. And for that reduced executive functioning, the problems with planning, prioritizing, making decisions, again, organization is the key. And just like you would use a recipe as a template for cooking a meal, these professionals we talked about can help people create templates for tasks that have multiple steps, like paying bills or completing one's income taxes or doing any other task at home or at work, so that the steps are laid out and the person doesn't have to figure out what is step 1, step 2, or step 3. And we're hoping that Ted was listening, as well as the kids, because they can really provide the help and support that Jayme needs to be successful. So it's incumbent on them to understand how Jayme's thinking and memory may be different than it was. And these kids are not too young to understand about things being slower or memory not working as well. They need to, again, create that time and space for important conversations with minimal distractions. And they need to make sure that they're communicating clearly. And there we talk about making eye contact, being very, very specific, repeating if necessary, and then making sure that whatever the message was received and understood. We want them to be patient and provide reminders if Jayme asks them to do so. But we really encourage the use of a family calendar for lots of reasons. Busy lives are hard to track. But when there's a family calendar, it reduces the number of times that Jayme might need to ask, when are you coming home? What's your after-school activity? What are we doing this weekend? Because people get tired of being asked the same questions over and over again. So the family calendar means everybody has a responsibility to share what they're doing, and everybody has a responsibility to look at the calendar so that they don't have to keep asking what's going on. So Mandy, can you now walk us through what are some of the approaches for dealing with the physical symptoms that Jayme's managing?
Absolutely. Thanks, Roz. So Let's start talking first about probably the biggest symptom that Jayme's dealing with and that's having the greatest impact on the family would be her fatigue. So probably the most important piece of managing fatigue is identifying what kind of fatigue she's dealing with. And it could be a combination of both. So what's the difference between primary fatigue in MS and secondary fatigue in MS? Well, primary fatigue is fatigue that's the result of the disease itself. It's a result of demyelination. That's primary fatigue. Secondary fatigue, on the other hand, is related to other issues. So, for example, maybe poor sleep because she's getting up in the middle of the night to go to the bathroom a lot, or fatigue because of a poor diet or inadequate nutrition. Maybe she's going long periods of time without eating because she's so busy or is forgetting to. Lots of fatigue related to that. Or perhaps it's deconditioning or other medical conditions like, say, for example, anemia can also contribute to fatigue. So secondary fatigue has other underlying causes that's contributing to the problem. So once that's identified what fatigue she's dealing with, or perhaps a little bit of both, it's important to use a strategy called the 4 Ps. And anytime you're talking about fatigue, I think it's important to note that your go-to healthcare provider for fatigue management is your occupational therapist. I mean, they are pretty darn savvy at kind of looking at your day and kind of dissecting it in a way to make it more energy effective for you. So one of the ways that they do this is using this 4 Ps strategy. 4 Ps stands for planning, positioning, prioritizing, and pacing. So by planning, we mean planning your daily activities in such a way that you're using your energy wisely. You're able to do what you need to do when you need to do it. So you're planning ahead. Using that family calendar, probably that Roz recommended, would be helpful too. Positioning. Positioning is something that I think we underestimate. So rather than doing an activity in standing, for example, can that activity be done in sitting in order to allow you to conserve energy that can be used and budgeted for later on during the day for activities that may be more meaningful or more important to you to do? So some examples might be, rather than putting your makeup on standing up, maybe you put your makeup sitting down in a chair. Or when you blow dry your hair, you're not blow drying your hair standing, you're doing it in sitting. For meal preparation, again, you could do some of that in sitting versus doing that in standing. Can those positions be changed in a way that allow you to conserve and optimize your energy? I would also add, I think it's important to note that how you're positioned, how you're seated is important. If you're sitting on a stool where you don't have any back support, and you can try this sitting at home, if you're just sitting on the edge of your chair without any back support, that's going to use a lot more energy than if you're sitting in a nice supportive chair and you're more relaxed, your muscles are more supported. That's going to, again, allow you to conserve more energy. So also be reflective on how your seated posture can be contributing to fatigue as well. The 3rd P is prioritizing, and this is pretty straightforward. Prioritizing those activities that are most meaningful to you so that it optimizes your energy. Pacing. I hear this one a lot in physical therapy. Patients come to the clinic and they say, hey, I had such a great day. I decided to paint a wall. I went and got groceries. I washed the car. I went for a walk, and I even went for a swim. But you know what? I haven't done anything the last 4 days because I was so exhausted. So they do on days when you feel really good, but then what I call exercise hangover or activity hangover that lasts for days and days afterwards, right? So that makes it miserable for you. We would encourage folks in that situation to consider pacing a little bit more, doing a little bit of activity, resting a little bit, doing activity, resting a little bit. So keeping that in mind is a way to help you budget your fatigue. So we've talked about fatigue. The next symptom that Jayme in particular is dealing with is foot drop. So foot drop is when you're toes inadequately and your foot inadequately lift when you're swinging your leg through with walking. Your toes might drag, and it makes people more susceptible to falls or to injury. And most of the time, our bodies are kind of clever in the fact that they don't always just allow us to drag our foot all the time and catch our toes and fall every step. We start to figure out ways to compensate by swinging our leg through or hiking our hip or other less efficient ways of walking that can contribute to fatigue as well as pain, among other things. So how can foot drop be managed? Well, hopefully you get in touch with a physical therapist and they help you, they prescribe some exercises for you that can help to manage that. They could involve strengthening exercises, stretching exercises, often too much tightness in the calf muscle or the muscle on the back of the lower leg can contribute to foot drop as well. So stretching that can help. And then there are also good bracing options available to you, and we'll show you a picture of that on the next page. The next symptom is balance and falls. Certainly, if you're at risk for falls, that can have a tremendous impact on your ability to maneuver around work and home, and it also creates a situation for your family and your loved ones that they're fearful to do things with you because they don't want you to fall, or they're fearful to leave you alone because they don't want you to fall and have an injury. So some of the ways that balance and fall risk can be managed: certainly get in touch with that physical therapist because they can prescribe some exercises, encourage some mobility aids, and specifically in the case of Jayme, she might be able to use a cane or maybe even some trekking poles or a collapsible cane, one that folds up and she can stick in her purse, and just use that mobility aid during selective times when she feels like her balance is compromised. Maybe at the end of the day when she's fatigued, or maybe when she has to walk on an uneven surface out of the soccer field. So she can kind of pick and choose when that assistive device or when that mobility aid can be most helpful for her. And then minimize trip hazards. So making sure those loose carpets, those loose rugs, those, in my house, it's the kids' shoes laying around that can cause anyone to trip. To make sure those are a nice clear path and that those issues are lessened. And last but certainly not least is the bladder. So what can we do when you experience bladder issues? It's important to reach out to a urologist, and the urologist can help you determine if you have a bladder that doesn't want to empty, so it stays nice and full all the time, or if you have a bladder that doesn't want to fill, so it's small all the time, or a combination of both. So a urologist can kind of help you figure that out, as well as a nurse practitioner. Sometimes our MS nurses are really great resources for helping you figure out your bladder situation. Either of those folks, in addition to your neurologist, can help prescribe some ideal medications for bladder issues. Also, they may prescribe or recommend you to see a pelvic floor physical therapist, which is somebody who could help teach you how to properly Kegel, to help strengthen some of those pelvic floor muscles and those lower abdominal muscles that can contribute to improving the bladder strength and the pelvic floor strength. And then lastly, behavioral strategies. And certainly these same healthcare providers could lend some information about that, but also a dietitian could be added to that list about what to drink, what not to drink, how often to drink, and how much to drink. So rely on those team members to help you navigate those waters a little bit. No pun intended. So here are some illustrations just to remind us all of some of these things that we can do to manage these challenges, particularly for Jayme and Ted. So the picture on the left is the gal in the kitchen, it looks like, and she's got a loose rug on the floor, certainly a trip hazard. I think this, as well as plush carpets, can often be tricky for people. I think it's also important to note where we often have rugs. We have rugs most often in the bathrooms and in the kitchens. And in bathrooms and kitchens is where we're doing a lot of pivoting and turning and changing directions and stopping and going. And sometimes those movements can be difficult without rugs, let alone with rugs. So just being aware of the environments where some of these surfaces are can also be something that you want to consider. So those trip hazards. The image on the right is an AFO, which stands for ankle foot orthoses. And what that is it's an orthotic, or it's a brace that allows the foot to kind of be positioned in such a way that it shouldn't drag during walking. So it can help someone manage foot drop. Now, this is one of many, many, many styles of AFOs that are out there. So don't feel like this is the only one. And if you don't like purple, by all means, you don't have to get purple. They have all sorts of colors. But talk with your physical therapist in combination with an orthotist, which is the healthcare provider who actually makes braces. They kind of work together as a team to find the most optimal bracing situation for your needs. So talk to those two team members if that's something you are challenged with. So what are some of the possible approaches for Ted and the kids to help Jayme? You know, picking up those items off the floor. I mentioned it's shoes at my house, but just keep a nice clear path so that Jayme's not having to weave around, navigate around all sorts of objects. Use a chore chart to distribute those responsibilities. And in my experience with my 3 kiddos, at least the 2 older ones at 8 and 5, a little money often sweetens the deal and helps with motivation. Keep everyday objects in their places. I think Roz mentioned this earlier. If Jayme's not having to look all over the house for where did the grocery list go, but it's in the same place all the time, that can minimize her fatigue because she's not having to do those extra steps. Find carpool opportunities for kids' activities. You know, it's not uncommon for people to say, hey, what can I do to help? Hey, can I help you? If there's something that people can do to help you, have that kind of list in the back of your mind so you can specifically say, hey, you know what? It'd be great if you could help bring one of my kids to piano lessons on Tuesdays. And more often than not, people are happy to help. Chip in when Jayme's fatigue kicks in. You know, I think it's okay for Jayme, and Jayme should be empowered to say to her kids and to her husband, you know what? It's getting rough, like I need some help. And the kids should be able to know specifically what they can do to help. So having that conversation, communication, as we talked about earlier. Consider a cleaning service. You know, I don't think anyone should turn down a cleaning service if that's a possible option, right, Roz? Never turn down the cleaning service. And then simplify cooking so that everyone can join in. You know, think about different ways the kids can help with stirring and measuring and use of crock pots, things like that. Just diversify those options that you can. Consider other options. Use your dietitian, use your occupational therapist to figure out those other strategies. I might also add, before I pass the baton back to Roz, that these are all strategies kind of for the day-to-day life. But I think it's also important for Ted and Jayme to think about what they're going to do in that situation where maybe she has a terrible relapse or she has to go to the hospital for a couple nights because she has a bad infection. We learned this the hard way as our family. I have 3 kids, but my middle child is a transplant recipient, and she went a couple years doing really good, no hospitalizations. And during that 2-year time frame, we had a 3rd child. We had a plan for what happened when she had to go to the hospital with 2 kids, but we failed to make that plan when we had the 3rd kid. So to make a long story short, we had a group of family and friends that jumped in. But I think it's important to always have that group of kind of go-to people that you know you can call up when things are heading in a difficult direction, who can jump in and know what to do without a lot of instruction. So that may be something they also want to do. So Roz, let's talk a little bit about some possible ways to start these conversations, particularly at work, because it can be difficult.
I just want to comment on the last thing you said, because I think it's such great advice. Any of us knows that we don't make the best decisions or come up with the best solutions in a crisis. And so as you plan ahead and you try to anticipate situations when the normal everyday routines won't work for you, you have to come up with something else. I think you're absolutely right that when people spend just a few minutes thinking that through ahead of time, and then if they find themselves in a crisis situation, they don't have to push a panic button because they've already figured out what their plan is. So I think that's really, really good advice. So we want to give you some conversation starters to help you get the help that you need when you want it. So first of all, with work issues, there are two really, really important resources that we want you to tap. So one is the MS Navigators at the National MS Society, and we'll make sure that the number for reaching them is in your slides when they get sent to you, but it's 1-800-344-4867. And if you call an MS Navigator at the National MS Society, or you call the Job Accommodation Network, which is another wonderful resource that you'll see, you might say something like, I really need more information about what my rights are at my place of work, because I'd like to make an informed decision about disclosing that I have MS, and also about what kinds of accommodations I might request from my employer. Just a way to start the conversation so that you can get the information you need to be successful. If you have a manager at work, you might say to your manager, you know, I would like to request a couple of reasonable accommodations that would help me be a more efficient and productive employee for you. I really want to do my very best for you and for our company, and I think these simple accommodations would help you do that. You know, having a desk closer to the bathroom would really help me conserve energy and manage my symptoms better. Could we think about whether I could move my office space? If you're speaking to a vocational rehabilitation counselor, you might say, I'd like some information about options for how I might get some retraining for a different job if I can't do the one that I'm currently doing, or what kinds of employment might be open to me if my MS symptoms make me have to change my career path. So these aren't the only ways to start the conversation, but we think they'll help you get started around work issues. Some conversation starters with the family. So Jayme, for example, could say to Ted, I'd really like to talk about how we could reorganize our chores, divvy them up differently, so that everything isn't falling on you. I really want to continue to contribute, and if my symptoms get in the way with some things, maybe there are other things I can take on. Or she might say to Ted, excuse me, can we talk about some strategies to carve out a little more time for us? Because we enjoy talking to each other, we enjoy doing fun stuff, but if we don't carve out time for it, it's not going to happen. With her kids, Jayme might say, you know, I'm kind of tired at the end of the day, but I'd really like to do things with you. What are some quiet activities that we could do together that would be fun for you and fun for me, even when I'm pretty tired? Or I seem to be tripping a lot lately. Could you please make sure to keep toys and shoes and other stuff off the floor so that I'm not navigating around all these little minefields? Or let's make up a chore chart together, and you can help me figure out how to divvy up the work around here so that none of us has to do the stuff we hate all the time. We can rotate. Let's figure it out together.
And possible conversation starters with the healthcare team would be, especially around fatigue. I seem to be exhausted all the time. Can you help me figure out why? That could go to any of the team members we've talked about, and then certainly to an occupational therapist who could really help you dissect your day. When I have to pee, I have to do it now. Is that my MS or is it from having kids? I need help. You know, you can be as direct as necessary to get your messaging across to make sure your healthcare team members, albeit they're quite busy, hear what you need help with. I used to be so sharp and organized. Now my house is in chaos and my performance at work is not up to par. What's going on? Again, you're just asking for clarification for why things feel so differently. Start that conversation. I'm embarrassed by the way I walk. I've fallen at work and I seem to trip even when there's nothing to trip over. Hopefully a PT would help you problem solve what's going on in that type of a situation. And I think with any of these conversation starters with the healthcare team, telling someone, anyone on the healthcare team, right, Ross, even if they're not the discipline that can specifically address that issue, it's good to get the message out there and they can hopefully direct you to somebody who can.
And I think the other thing about the conversation starters and the reason we started including these in a lot of our webinars is that people will say to us, well, I didn't bring it up because I didn't know if it had anything to do with my MS, or I didn't know how to ask, or I didn't know who was the right person. And I think what Mandy's saying is really important. You don't have to worry about whether it's the right person. You don't have to worry whether you're saying it exactly right. The point is that there's very little that you can mention that people on the MS healthcare team haven't heard before. And if it's something that they don't believe is related to your MS, they will say, you know, that could be something else that's going on and you really need to run that by your primary care physician because that really is not a symptom associated with MS. Or they can direct you to the right person. So don't be bashful or worried that you're not going to say it right. Just say it and trust your healthcare team members to steer you in the right direction.
So we've talked a lot about communication and starting this conversation, but realistically speaking, there are lots of barriers to this. And Roz kind of alluded to the first one on this list, embarrassment. You know, sometimes it's tricky and it's really humbling and humiliating to talk about your bladder with your doctor or to talk about some issues that are a bit more private with your healthcare providers or with your loved ones. No good time, no good place, so why talk about it at all, right? Just dismiss it, push it under the rug. Maybe people worry about not wanting to upset or worry others, or you don't like to ask for help. You know, you don't want to burden those people that you love so much or that you feel like they're already doing so much for you. So you just don't bring it up. You don't even start the conversation. Mood and cognitive symptoms can certainly interfere. It can influence the desire or the ability to have some of these conversations. And also fear of disease progression. That's really real. I think when you start to have these conversations and acknowledge these challenges exist, then it makes it the disease more real, more obvious, more front and center. Not wanting MS to be the center of everything. So you just want to push it to the side, ignore it, pretend like it doesn't exist. I'll deal with it when it needs to be dealt with. Sometimes people don't bring things up to their doctor because they want to be a good patient. They want to be the one that looks good, feels good, and does exactly what they're supposed to do with the most ideal outcomes. They don't bring it up for that reason. Or maybe they're fearful of their loss of employment or the implications socially or economically with respect to their jobs if they would start to talk about their MS or disclose their MS. So, Roz, given the fact that these are so real and really tricky, like how would you suggest people start to overcome some of these barriers and overcome some of these challenges?
It's a good question, and I think the first answer is kind of a simple one, to bite the bullet. Because all these things that we worry about, we don't want to be embarrassed, we don't want to upset the other person or worry the other person, burden the other person. the fact of the matter is that the people around you who care about you and love you are thinking about a lot of these things anyway. And so there you are, both worrying, both thinking about them, both wondering what to do. And that's pretty tiring and time consuming and emotionally draining. So when you just bring up these topics that you're so worried about, everybody can sort of breathe a sigh of relief and start talking about them. Some practical strategies for dealing with whatever the issues are that need to be addressed. If jump-starting these conversations is just hard, you're worried about how to begin or what to say or when to say it, this is when sitting down with a therapist or a counselor can be really helpful, because those professionals have a lot of experience at helping you feel comfortable talking about the things that are important to you in sort of a safe and comfortable environment. And so you can work with that third person just to get yourselves started on the conversation. And I want to call out the wanting to be a good patient one, because I actually had a lot of personal experience with that when I was a therapist in an MS center for many, many years. And people would come to me maybe after they had seen the neurologist or a different week from when they saw the neurologist, and they would start to tell me about all these symptoms that they were having or challenges that they were having. And so I naively would say, well, did you mention that to the doctor? And I frequently heard things like, oh, I didn't want to bother him, or I didn't want him to think I wasn't doing well, or I didn't want to be a nuisance. You know, that's what the doctor is there for. If you ask the doctor to help you make treatment decisions without giving him or her all the information about what's going on with you, you're asking the doctor to treat you and care for you with their hands tied behind their backs. They can't do it. So I think it is getting all of this information out there in these important conversations so that then you can come up with solutions and move on, so that MS isn't the center of anything anymore, and you don't have to be worried about whether you're upsetting anybody or if your disease is progressing. You just deal with it and free yourself up to move on. And so I think we want to now make sure that you have some really important resources that you can check out for the kinds of help that we're suggesting. Again, the MS Society Navigators are excellent for giving information, for helping you find referrals in your local area to these healthcare professionals that we've talked about. And they're trained social workers and counselors, and so they can provide you with emotional support while they're doing all these other things for you. The team also has a group of employment and benefits specialists, so they can help you with your employment questions, your rights under the Americans with Disabilities Act, how to talk to your employer about your MS if you choose to disclose, and how to ask for accommodations. In addition, the Job Accommodations Network specializes in helping people figure out what kinds of accommodations would help them be successful in the workforce. And so you can also contact Jan directly. And the state vocational rehabilitation services, they differ from state to state in terms of what they're called, but every state has rehabilitation services, and that they are excellent for getting information about employment, job retraining, and that kind of thing. And you can find the names of physical therapists who have an interest in MS or have an interest in neurologic diseases by going to the American Physical Therapy Association, apta.org. And the same thing for occupational therapists by going to aota.org to help you find those folks. And although the National MS Society can provide referrals to many of these healthcare professionals. We also like to point out a group called helppro.com, which is a website to help you find mental health professionals in your area. And the reason that I like it so much is that the website gives you a lot of detailed information about a mental health professional, what they look like, where their office is it accessible, what their special interests are, what kinds of insurance they accept, whether they do telehealth or only in-person therapy. So it's just a very good website to go search out mental health professionals for yourself.
So with that in mind, hopefully you had a chance to submit your questions. We're going to get to as many as we can here in about 10 minutes, but I'll let you know about other ways to submit questions in just a little bit. And again, all part of a big picture of wellness here. So let's dive into work, home, and relationships, and we'll start with work. We've got a lot of questions about disclosure and whether to be upfront about having with MS, how to be upfront with having MS. So just kind of generally, what do you think should be the top considerations about being upfront about having MS? And what happens if those conversations don't go well and there's hostility or just discomfort with some of those conversations?
So I'll start with that, and then I'm sure Mandy may want to add something. But I think that the most important thing is that disclosure in the workplace is a very, very personal decision, and people decide to disclose or to keep their MS private for very, very different reasons. The important thing to know is that if you feel the need for accommodations in order to perform your job better and to be successful in whatever your role is at work, you do need to disclose that you have a disability. You may never need to mention specifically that you have MS, but you may eventually need to tell exactly what the disability is, and your doctor may need to support that disclosure. There is a tool on the National MS Society website that can actually walk you through when to make a decision, whom to disclose to, what kind of information to provide. So you can go try that tool, but you can also call an MS Navigator or Jan and explain your situation and get some assistance on whether it's appropriate to disclose at this point and what the benefits are. In general, we encourage people not to disclose unless they have accommodations that they need to be successful. But that being said, some people work in a small working environment. They don't like keeping secrets. They're just not comfortable. And so they decide to disclose to their manager or their coworkers simply because they feel better sharing the information. So again, it's very, very personal. And in terms of what to do if you don't get a positive response, that would certainly be a time to contact Jan or the National MS Society for the next steps you can take to protect your rights in the workplace.
Great, thank you so much, Roz. Moving on to home and just feeling good in our home and feeling safe in our home. What resources are out there to learn more about modifications or adaptations? And when do you think the line goes between modifying the home that you have and maybe seeking other housing options?
Sure, that's a good question, and that's a very personal question, I think, to answer. So honestly, your best resource for what are the most ideal adaptations for your home would be to talk with your physical therapist and your occupational therapist, and or your occupational therapist. You can get one or both of them to come into your home and kind of do what we call a home assessment to see what is working well, what could be improved upon, what could be easier, what are the strengths, what are the barriers of your home setup. And honestly, from there, you can make a determination of what is your individual threshold for adapting your home. Some people absolutely, once they need a grab bar, they don't want a grab bar. They don't want anything that's going to make their home look quote unquote disabled. So I think everyone's threshold for what is an acceptable amount of equipment or modifications is very, very personal. If you just want a general resource, you can go to the ada.gov website. They have checklists that are available where they would kind of walk you through potential modifications, potential challenges in the home, and ways that you can manage them. So the ada.gov does have some checklists as a general resource, but I would work with your PT or your OT to make that determination of what is best for you and your situation.
You know, there's one other resource that can be very useful. The Veterans Administration has materials on redesigning a home for wheelchair accessibility. And this relates to the second part of your question, Brian, that sometimes in an existing home, you can do some restructuring that actually makes rooms more accessible, you know, widening doorways, putting in a ramp to get out the front door, things that make bathrooms more accessible. But sometimes when people get a consult from a PT and they see the extent of the construction that would need to be done to make something wheelchair accessible, that's when they decide perhaps to look at another home that's all on one floor, or that's more modern, that may already have wider doorways, or move into housing that has some other support, some assisted living kind of place. So I think, again, as Mandy said, it's a very personal decision, but these healthcare providers can really help you think through what those options are so that you don't feel trapped in your own home or trapped in one or two rooms of your home because it's not accessible to you.
Another part of wellness related to home are roles and responsibilities that people take a great deal of pride in, and it kind of leads into relationships. So what tips would you have for someone to either let go of duties without feeling like they're losing or letting people down, or how to take more responsibility at the home?
You know, I think what we talk about most at cont'd is that we want people to feel like their relationships, their partnerships stay balanced, as Mandy mentioned earlier on. Everybody needs to feel like they're contributing to the family and to everyone's well-being, and everybody needs to feel supported and cared for by others in the family. So we get concerned when it starts to feel out of whack for people, out of balance. A support partner may be taking on more and more and more, and the person with MS is doing less and less. And in that situation, neither person feels good, right? So it's talking about how can we swap around some of these responsibilities. If I can no longer do some of the very physical things that I was doing, are there other chores or responsibilities in the house that I could take over from you while you do more of the physical things? Same with cognitive challenges. If I can no longer manage the bank account, or I can no longer deal with bill paying, can you take that over and I'll do some of the other daily tasks? It's a communication about how to keep things balanced so that each person feels good about their role in the partnership.
That's a great response. Thank you. I think we have time for one more question. Actually, let's do two more questions because this one just came in, and I think it's an important one regarding relationships and having children. The question is: can a woman that has MS get pregnant and have a safe and healthy delivery?
Yes. That is. The simplest answer to that is yes. Several decades ago, women were told not to have children, as were men, because they would not be able to be good parents or it would affect MS. We now know and have known for quite some time that women with MS can conceive, can carry and deliver healthy, happy kids, and that childbearing will not negatively affect their MS, and their MS will not negatively affect the pregnancy or the child. So the word of advice is to make sure that your healthcare team, particularly your neurologist, knows your wishes and priorities related to this, because the decisions around your disease modifying therapy may be different based on the fact that you are planning to get pregnant. And so you can work with your doctor to pick the best medication for you to be on until the time that you get pregnant, and then what medication to get back on after you deliver or after you finish nursing your baby, if you choose to do that. It's an unqualified yes. Women
That's
can
a great
have.
question and an important one, so I'm glad we got to answer that. Last question, as we're running up against time here. As we talk about relationships, we have a lot of single people on the line that don't feel like they have a relationship. They feel kind of like they're going alone. So what tips would you have for them to get motivated to work on their physical, emotional, and mental well-being?
Well, I'll start, but I think everybody has support, right? People may not be in a one-on-one relationship, marriage, or partnership, but people have friends, family members, neighbors. You can also get support from online chat rooms where people with MS get together and share information and resources and support. So I think it's important for people to recognize that if there's not a support person sitting right there next to them, that doesn't mean that they can't find support. And I think in terms of taking care of your emotional well-being, whether you have support partners with you or not, it's making sure that your healthcare team knows how you're doing emotionally, in the same way that the society recommends early and ongoing screening for cognitive function. They also recommend early and ongoing screening for depression at the time of diagnosis, and then at least yearly thereafter. And that screening, again, is to identify people who are struggling emotionally and need extra support or help to manage their symptoms, because life with MS is challenging enough without trying to do it under the cloud of depression, which is very painful. So don't hesitate to let people know what you need, whether it's your loved ones or your healthcare team, because they will help support you through this.